This next story came to us shortly after we launched our Patient No More series. We posted to social media asking people to share their experience with denied claims, and that is where we found Linda Brown, who has a rare blood disorder.
You think this is really a voice of the community thing, that the more people who speak out, the more likely there's going to be a solution?
Yes, it just takes one voice to be heard.
Her voice is now being heard. Investigative reporter Adam Walser listened to her story after her insurance company refused to pay for medically necessary blood transfusions. That is, until her doctors stepped in.
Good boy. Let's go. Come on.
At first glance, Linda Brown looks like most dog moms as she takes her favorite companion, Ted, for his nightly stroll.
You're the best, Ted.
But Linda has a disease that affects only 1 in every 250,000 Americans.
It's a genetic blood disorder, alpha thalassemia.
The condition affects her hemoglobin, which can cause low levels of oxygen in her blood. Linda works full-time in a law office and regularly attends concerts with her daughter Connor.
This is the one we went to see the Red Hot Chili Peppers, and I was thrashing and Connor was making fun of me.
But over the years, Linda has needed blood transfusions.
I had periods transfusion dependency, meaning a couple transfusions a month or every month.
These transfusions are very expensive, right?
Yes, they're several $1,000s, and every time I had one, I had to be admitted to the hospital. They would keep me overnight to monitor for reactions to the blood.
When her transfusions became more frequent, Linda says her insurance company denied her claims.
They'd tell me, no, we're not going to pay this claim. It was ridiculous. Cyclical and ridiculous, just kept going round and round every time. They said they would pay for one transfusion a year. And at that point, when I was getting several a month, that's like telling a stage 4 cancer patient, you get one treatment this year, good luck.
Her doctors stopped treating her because they weren't getting paid.
The hematologist eventually told me, don't come to us for a referral, just go to the ER so they can transfuse you.
And that's the most inefficient, most expensive way to treat a patient.
Exactly. Because the insurance company refused to pay, there was a time I was at almost $300,000 in medical debt.
And all this time you're paying for health insurance.
Exactly. I've been paying for it for a couple of years, several $100s out of each paycheck to cover myself and my daughter, and I paid the deductibles, yet they wouldn't help me.
For Linda, the emergency room was the only option for several years.
What would happen if you didn't get the transfusion?
I would go into multiple organ failure. There were times I went to the hospital like the time my heart stopped.
That's right, her heart stopped.
That was the day I died.
How long were you under?
8 minutes.
Thankfully, it wasn't her time to go. But Linda admits she didn't go to the ER sooner that day because she didn't want to grow her debt, a situation that took a huge emotional toll.
And there were times I felt like I would be better off dead instead of trying to fight this, trying to keep going, trying to survive.
Dr. Bill Hennessy is a physician who runs a company called Care Guide, which helps patients reduce healthcare costs and fight denials. He says patients have another option even after claims and appeals are denied.
There's also peer-to-peer reviews that can occur.
That's when a specialist treating the patient directly contacts a specialist in the same field hired by the insurance company, often a consultant. The patient's doctor provides extensive evidence of why a procedure is effective and necessary. Hennessy says peer-to-peer reviews are rare since most patients don't know about them and doctors are often too busy to do them.
We don't get paid to do those peer-to-peer. So it eats at our time while we have to pay all of our staff an overhead.
But peer-to-peer reviews often do work. Linda says years of denials came from rank-and-file claims examiners.
They have people reviewing these claims who don't know those things, who may not have a medical background.
But when she begged her doctors to get involved, things changed.
A group of hematologists and a cardiologist were writing letters on my behalf to the insurance company, imploring them to pay these bills, saying these are medically necessary.
And did they ever pay those bills?
Eventually. Eventually, they just settled out with the hospital.
And would you still be here today if those doctors hadn't fought for you and you were able to get those transfusions?
Probably not.
Patients are sick of being denied health insurance coverage. Doctors are fed up with insurance companies overruling their treatment plan. So what are the insurers saying in response? We'll show you what happened when we reached out to the top insurance companies next.